And the Rebound Buffalo is our commitment to getting your family answers to questions about COVID-19 that matter to you. That's why we're going to answer your questions every morning, right here on 7 Eyewitness News at 6. And this morning, Dr. Stephen Turkovich, Chief Medical Officer at Oishei Children's Hospital, is answering your questions about going to the hospital during a pandemic. If I need to go to the hospital for something, is it still safe to go into the emergency room, let's say? Do you still want people going to the emergency room?
Absolutely. If you're not feeling well and you feel like you need emergency care, please come. What we have seen in this pandemic is an increase of what we call excess deaths. So when you look at the number of people that traditionally die in a specific time period, let's say a several month period, historically over the last few months, and you compare that to what we're seeing now, we're seeing more excessive deaths. So that could be due to multiple things. People could be dying of COVID at home when we don't know, or more likely, people could be having other problems that they're putting off because of fear from going to the emergency room.
And how about for your staff and for working in the hospital? Have things changed on your end? Are you seeing more patients? What's changed for healthcare workers?
So it's sort of a pediatric and adult story. On the pediatric side, we're seeing less patients. It's a similar story that what we've seen in the beginning of the pandemic. If you compare our inpatient volume now to where we were last year when we were flooded with patients with RSV and flu, it's significantly lower. On the adult side, the volumes are significantly higher. So from a Kaleida perspective, we peaked at about 115 inpatient patients with COVID back in April, at the end of April. As of yesterday, we had 173. So you can see we've significantly increased where we were. And that's really just over the last month. On November 1st, we had 18 inpatients with COVID across Kaleida, and now we're at 173.
Wow. So in just that 30-day period.
Yep.
Do we know how to better treat COVID-19 now when people come into the hospital? Are we seeing people doing better than they were in the past?
Yeah, fortunately, we've had some dramatic improvements in the treatment since the pandemic started. If you look at just the number of people in the ICUs, it's significantly less than we were at the beginning of the pandemic. We only have out of those 173, 30 or so of them that are in the ICU, and even less. I think we've got about 12 or 13 that are on ventilators. If you remember, at the beginning of the pandemic, the worry was not having enough ventilators and not having enough ICU beds. But because of things like dexamethasone, which is the steroid, we've been able to dramatically decrease the number of patients that need critical care and ventilators. So due to the improvements, we are seeing some significant improvement in patients going home sooner after being admitted, but also not needing the ICU.
There you go. That's Dr. Stephen Turkovich, the Chief Medical Officer for Oishei Children's Hospital. Again, answering those questions. You heard him say in November, 155 additional COVID patients in just the Kaleida system. These numbers are staggering. So we know these are uncertain times. There's a lot of information and misinformation out there. So we're continuing to get answers to your questions this week. Tomorrow, it's going to be all about vaccines. I know there's a lot of questions about those. And we also have a form available for you at WKBW.com where you can ask any question about the current state of COVID-19, and we'll try to find you those answers.